And of the three parts that have been discussed in this bill, I am not going to tell a story, because the stories we have heard today are reason enough to pass this bill right now, today. But this bill should pass today not only because it helps those people that you've heard about, and many, 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 many more like them, but because it also makes good sense for Maine. This bill is good for Maine people, good for Maine businesses, and especially good for Maine's hospitals. This bill is a great deal for Maine's budget and Maine's health, and if we don't seize the moment, it could pass us by. The renovated liquor contract is good business for Maine. The contract, as structured in this legislation, will bring better options for Maine consumers, better prices, and better enforcement. As a state, we have learned a lot in the last 10 years, and the bipartisan agreement in this bill puts us in a stronger position going forward. The financing in this bill is structured in a way that, unlike a lot of the work we get to do in this building, is about truly a long-term vision. It pays the hospital debt that is owed right now and must be paid. But it also provides an ongoing funding source to capture federal dollars and support sewer and drinking water projects. It also will provide funding for roads and bridges. And when the hospital debt is paid, this bill will return more than $130 million to the Budget Stabilization Fund. That is good news for Maine. And accepting federal dollars to expand healthcare in Maine makes great sense for Maine people. If we do not accept these dollars, they will go to other states, as will the expanded access to healthcare that Maine people so desperately need. The federal government will cover 100% of the cost for 3 years, and after that it will be 90%. 90%. The state of Maine can and will be able to afford those costs. By then our hospital debt will be paid. We will be able to use the money Maine has already accepted, more than $35 million that this administration has already accepted, to renovate the way we do business in Maine, the way we provide these services. This is not going to be the same MaineCare program that we see today. It is going to be a program that focuses on health outcomes, that focuses on accountability with providers and for patients, and that focuses on outcomes as the measure of success, not the number of tests that are provided and given. The federal government will cover those costs. And if it doesn't work for Maine, we can opt out at any time, and that is a fact. We cannot count people like widgets, but we do know that it will be nearly 70,000 people in Maine who will have expanded access to health care. I talked to the business owner this weekend who said to me, "Emily, please expand Medicaid." He said, "I hate Medicaid, but please expand it because I employ a lot of people part-time who would be covered under this." And right now it's hard, because right now we end up holding charities, we end up holding fundraisers, and fundraisers are not a healthcare plan. And so today, we can take a step in the right direction for Maine's businesses, for Maine's budget, and for most of all, Maine people. Mr. President, that's why I'm rising to support the majority ought to pass this amended report today, because it is the right thing to do, period. Thank you, Mr. President.